Dental Office Emergency Case Study Project, Epistaxis by Madison Howard. In this case study, a patient arrives for their routine cleaning appointment. As the clinician reviews the medical history, they see that the patient states they have been suffering from a sinus infection. The hygienist begins the prophy, and the patient then experiences an epistaxis event. During the prophylaxis, the patient begins to experience an epistaxis event. The procedure is terminated and the saliva ejector is used to remove any blood from the mouth. Activate the caps of CPR, place the patient in an upright position with their head tilted forward, instruct the patient to pinch their nose for 15 to 20 minutes, and breathe through their mouth. Provide a bag or a basin so they may spit out any blood. To help with vasoconstriction, place an ice pack on the bridge of your patient's nose. You should then instruct the patient to keep their head elevated for at least 4 hours, do not blow their nose, avoid heavy lifting or bending at the waist for at least 24 hours, keep nostrils moist using a humidifier and a lubricant, ensure your patient is hydrating, and avoid medications or herbal supplements with anticoagulant properties. Epistaxis, bleeding from the nose, aka a nosebleed. Some causes of epistaxis are digital manipulation or picking your nose, allergies, illicit drugs such as cocaine, sinusitis or infection of the sinuses, trauma, upper respiratory infection, medication and herbal supplements with anticoagulant properties such as NSAIDs, aspirin, garlic, and ginseng. It is important to know that there are two different types of epistaxis. There is anterior epistaxis and posterior epistaxis. These are differentiated based on the location and severity of injury within the nose. Anterior nosebleeds make up 85% of nosebleed incidents. They occur at Kieselbach's plexus or Little's area. Due to the location, it is easy to traumatize the area. Posterior epistaxis is most common among the geriatric population. Posterior epistaxis occurs at Woodruff's plexus. The severity of posterior nosebleeds is much higher because it is more difficult to isolate. Anterior versus posterior epistaxis signs and symptoms. In an anterior epistaxis event, the patient would experience slow oozing blood with a bright red appearance. In a posterior epistaxis event, the patient would have a more severe response. They would experience profuse bleeding, the blood would be darker in appearance, and possibly thicker in texture. The patient could also experience gagging, coughing, and vomiting with the posterior nosebleed due to a higher volume of blood. Here is an image to help show the location of anterior epistaxis and posterior epistaxis. As you can see, Kieselbach's plexus is more anterior than Woodruff's plexus. It is important to note that Woodruff's plexus is much closer to the throat, which is why some symptoms of posterior epistaxis are gagging, coughing, and vomiting. The location of Woodruff's plexus also contributes to the difficulty of managing posterior epistaxis. Treatment for an epistaxis event. Stop the procedure, then identify the cause of injury and the severity. Is it a posterior or an anterior nosebleed? You should then ensure the patient has proper circulation, an open airway, and normal breathing. Use the saliva ejector to remove any blood from the mouth, as this could block the airway. Place the patient in an upright position with their head tilted forward to prevent the blood from flowing back into the throat. Instruct the patient to pinch their nose for 15 to 20 minutes and breathe through their mouth. Provide a basin or a bag so they may spit out any blood. If your clinic has ice packs on hand, provide one to your patient and have them place it on the bridge of their nose. This will help with vasoconstriction and hemostasis. Instruct the patient to not blow their nose. If bleeding continues, contact EMS as the patient could lose too much blood and require a transfusion. Cauterization of the area may also be needed. It is important to note that PPE should be worn at all times when assisting a patient during an epistaxis event. These are some important post-care instructions after an epistaxis event, as well as how to prevent epistaxis from happening. Instruct the patient to keep their head elevated for at least 4 hours. Do not blow their nose. Avoid heavy lifting or bending at the waist for at least 24 hours. Keep the nostrils moist using a humidifier or a lubricant. Ensure your patient is hydrating. Avoid medications or oral supplements with anticoagulant properties. And patients with hypertension could be at higher risk for epistaxis.